the treatable causes. H's and T's. They're no different from the pediatric. So I got to think about my treatable causes.
And possibly because of the baby being hypoxic, which all you probably need was a little bit of oxygen to get the heart back up and
yeah, probably maybe some little fluid too, because the vessels dilate, they become leaky, right? So the stress part, the most stressful part is how much of this drug I give. And when we don't know how much to give, what we don't do, don't give it. And could that make a difference maybe in the success of the resuscitation of a kid? It could be. But that's an added stress and burden on you. One, few. The pediatric patient is few and far between, right? They call low volume, high risk patients. And when we have that low volume, high risk patient, that right there puts you at a level of stress that's beyond normal. And when that stresses your body, we know the sympathetic system kicks in, the anxiety builds up, and now I not only have to resuscitate this kid, I have to control my emotion and the balance of my sympathetic trying to override for something being so stressful and overwhelming. It's hard to balance. So what I can do to minimize it is know how to resuscitate, know my drugs, know all that good stuff. But it's 100% stressful, I don't doubt it. So what I'm going to teach you right now is how to take the math out of your medication, how to take the calculation out of pediatric pharmacology. No calculation whatsoever. If you can find the patient's weight, you'll always give the right medication dose. How hard is it to figure out weight now? Did I lessen the burden? How can you find it? One way, look, see, or ask mom. Get the Broslo, if you carry a Broslo. Ask mom how much this kid weighs. Convert that into kilos. And then we're golden. It's downhill from there. That's the peak of the uphill battle right there. From there it goes down. All right? So we have what's called the FSF. Anybody ever heard of that before? No. FSF. Felix's simple formula. I'm going to take the math out of it. So let's talk about, now this doesn't work for every single pediatric medication you give. It works.